and welcome to the first session of ACE. ACE stands for Alcohol Consumption Education, and that is exactly what you will be hearing throughout this program. This program will take place online whenever and wherever you feel most comfortable. Alcohol consumption presents many health risks, and this program will highlight many of them in hopes to decrease your overall alcohol consumption. ACE branches off of Title IX, which is a mandated online intervention program. Upon completion of each session, the registration hold on your student portals will be taken off. You will also receive an email before each semester reminding you to complete the next session. Session 1 will go over the risks that are associated with heavy alcohol consumption and how attitude plays a significant role in drinking. Session 2 will discuss the roles that external factors have on drinking, and Session 3 will be the final refresher course. We will now start with session number 1, targeting your attitude. Are you guys ready? Grab a snack, find your comfy spot, sit back and relax. I promise you the information you're about to hear is very interesting and, more importantly, beneficial to you. Let's begin. Binge drinking is the consumption of an excess amount of alcohol in a short period of time. For women, this means 4 or more drinks in one sitting, and for men, 5 or more. Like most people, many college students are unaware of the proper serving sizes for the alcoholic drinks they consume. So, let's go over the correct serving size for the 4 different types of alcohol. For beer, 12 fluid ounces at about 5% alcohol content. Wine, 5 fluid ounces at about 12%. Malt liquor, 8 to 9 fluid ounces at about 7%, and distilled spirit, 1.5 fluid ounces at about 40%. Did you know alcohol use is estimated to account for 4% of deaths worldwide? Now, this may seem minimal compared to chronic diseases such as cancer and heart disease, but alcohol is still dangerous to your health and in many cases can be a predictor for these chronic conditions. Within the past 40 years, the world has seen an increase in alcohol consumption. This is a serious issue affecting several populations, including you. Despite intensive prevention efforts, the levels of high-risk drinking have remained unchanged in recent years, with some data suggesting alcohol-related morbidity and mortality among ages 18 to 24 years old. So how does this problem relate to you? Young people ages 20 to 29 represent about 9.1% of the users of alcoholic services, such as the purchasing of alcohol. According to the American College Health Association, 40% of male college students and 27% of female college students report engaging in heavy episodic drinking. Binge drinking is the most prevalent pattern of alcohol consumption among youth and one of the most dangerous. Heavy alcohol consumption affects men and women differently. We will now discuss in detail these differences. Although there are many health risks associated with heavy alcohol consumption, breast cancer is one that many of you may not know. This may be because it is not widely talked about, which is why we will discuss this risk in more detail. According to recent studies, the risk of developing breast cancer in women increases by about 7 to 10% for every alcohol beverage consumed daily. This is because breast tissue has a higher susceptibility to carcinogenic effects like alcohol compared to other organs in the body. Let me explain this in more detail. Before a woman's first pregnancy, breast tissue is rapidly producing and they are at an increased biologic vulnerability. But after a woman's first pregnancy, the breast tissue goes through a change that helps fight against forming into cancer cells. In fact, those consuming alcohol before having their first child were at an increased risk of about 34% compared to those who did not drink until after their first child, or those who did not drink at all. The type of alcohol you consume also plays an important role in the development of breast cancer. Red wine is thought to protect against cancer development, whereas beer contains compounds that are potential cancer agents. So to all the men out there, you are probably wondering why this is relevant to you. Every one of you has a female friend, a significant other, or a family member whose health is at risk because they might be consuming alcohol as well. Now that you know this information, share it with the women in your life. They may not know of the risks they are at if they consume alcohol. Who knows, by telling them this information, you may improve their overall health not only now, but also in their future. So guys, think before you drink. You may not see the effects of your drinking now, but take this information as a precaution and remember what we have told you the next time you decide to drink alcohol.